Hello guys, welcome back to my channel, and today we are going to talk about FASD and the link of blood sugar. And at the end of this video, I will actually teach you guys how to manually check your blood sugar at home. Let's get started. So did you know there is a link between prenatal alcohol exposure, FASD, and blood sugar issues? Let's start all the way at the beginning. When someone drinks alcohol while pregnant, how does that affect the baby's blood glucose levels and how that can trigger issues in blood sugar control later on in life? Prenatal alcohol exposure can alter how the body handles glucose and insulin, leading to higher risk of metabolic issues like type 2 diabetes or atypical insulin levels in adults. People with FASD can have metabolic issues, and there's many different types of metabolic issues that people with FASD can have. One of them is type 2 diabetes. Other link is people with FASD can have autoimmune issues, and we are at higher risk for autoimmune diseases like type 1 diabetes, which is an autoimmune disease. Type 2 diabetes has also a very heavy link of genetics. So does type 1, also has a heavy link of genetics as well as the autoimmune component. Did you know people with FASD can also struggle with not high blood sugars but also low blood sugars when it comes to hypoglycemia? Hypo meaning low blood sugar. Prenatal alcohol exposure can disrupt fetal glucose metabolism, leading to low blood sugar, hypoglycemia, during late gestation and the prenatal period. Emerging health data also indicates that some individuals with fetal alcohol spectrum disorder may experience struggles with blood sugar regulation and reactive hypoglycemia later in life. Inability to store glycogen properly could affect people with FASD and struggling with hypoglycemia. When your body realizes that its own blood sugar is going low, it sends out this signals to the liver to push out sugar into your bloodstream. But if the liver doesn't have storage, or if the central nervous system is already damaged and the control system isn't happening, those systems might be malfunctioning in the process. What is reactive hypoglycemia? Reactive hypoglycemia is low blood sugar that happens 2 to 4 hours after you eat a meal. It occurs when your body releases too much insulin after you digest food, causing your blood glucose levels to drop below normal. Did you know it's really hard to catch hypoglycemia on a regular blood test? Because your body will already have corrected itself before you go in for the blood test. That's why it's really important to have your own glucometer with you so that you can check yourself once you start getting those symptoms, and you can check right away, because your body will be like, oh, we're going low. Okay, and it will tell the liver to put sugar into your bloodstream and then raise it appropriately. Yeah, that's why it's really hard to catch hypoglycemia just on a regular doctor's blood test. So what is the range of a normal blood sugar? Usually I'm going to use Canada metrics because I live in Canada, and then I will show you sort of the other metrics that other countries use on the screen. So our metric would be, you want to be around 4 to 10. If you are higher than 10, you are probably experiencing something called hyperglycemia, which means high blood sugar. And if your blood sugar is lower than 4, you might be experiencing hypoglycemia or low blood sugar. What are the symptoms of low blood sugar? Shaking, irritability, mood swings, lethargia, dizziness, sweating, issues with verbal communication. This is important when we talk about FASD. If people with FASD are more prone to blood sugar issues, then some of these behavioral outbursts might be because of hypoglycemia and not just it's just behavior. Your brain relies heavily on glucose to function. I don't want to hear sugar is bad for you. You live off of glucose. You cannot function without glucose. Your brain needs glucose to function. Your brain needs carbs to function. When your brain and body are already having trouble with daily tasks and executive functioning, you might be depleting those blood sugar storages way faster than the average person, especially if you are a child/teenager mixing with hormones. If you have a kid and you notice their behaviors tend to get really bad right before any meal time, after school, after physical activity, it could be a blood sugar issue, and they might need extra glucose to function and to make sure they are not going extremely low. Also, something to consider, especially kids with FASD whose bodies might struggle with the ups and downs in blood sugar. You should always make sure you're taking what is called a fast-acting carb first to make sure your blood sugar rises quick, but then to make sure you're having something that will stabilize that blood sugar. So you might have like a juice and then make sure you're having a protein after, or a harder carb that's slower acting. I always carry like granola bars in my purse. I don't really do a lot of fast acting. It just doesn't make you stay up appropriately, in my opinion. So I just do like granola bars, crackers. If I'm home and I have cheese, then I try to eat carbs and protein. Sure, your balancing is really important, because you could be like, okay, let's have a snack, let's have some fast-acting sugar, and you give the kid fast-acting sugar, and you're not going to eat for a while, the kid's just going to bottom out again. It's not going to hold them. If you know the kid, you're going to have dinner soon, but the kid needs something, then a fast-acting carb might not be too bad, because you might have protein in dinner. So that might not be too bad. High blood sugar symptoms, if you're concerned about type 2 diabetes or type 1 diabetes, is extreme thirst, urinating a lot, also irritability, lethargia, loss of weight in type 1, sometimes gaining weight in type 2. I think you can also lose weight with type 2 as well. That could be one of the symptoms, because excessive loss of weight in a short amount of time is definitely a symptom of type 1, which is very concerning. Their breath smelling fruity could also be a sign, because your body starts developing what is known as ketones, which is also not good. So a high blood sugar is 10 and higher, 10, 11, 12, those sort of numbers, extended period of time, and they're not going down. That could be an indication. And if you're fasting above 7, can be pretty dangerous. It is normal for your blood sugar to go on the higher side when you eat. A lot of people that have normal blood sugar control will test their blood sugar and be like, oh my god, why am I so high? But they just had a really high carb meal. It's normal. Don't freak out. It doesn't mean that high carb meal was dangerous for you. Your body's doing what it's supposed to be doing. Your insulin will kick in. Don't worry. It's when your insulin doesn't kick in at an appropriate time that you need to worry. Like if you have reactive hypoglycemia, your blood sugar might spike and then it doesn't stop going down. And then you're in the hypoglycemic stage. That is also not normal. Your body should be up and stable, a little peak and stable. It should not look like a roller coaster. Do I have all of this? Well, because I do so much research on FASD, and I learned about FASD and hypoglycemia and all that, I thought I was having hypoglycemia episodes. Turns out, low iron can mimic high and low blood sugar symptoms. Thanks, internet, for telling me that. Not. I had to do a ton of research after the fact. I have an autoimmune condition called autoimmune atrophic gastritis, where my own immune system attacks my stomach cells that in turn have trouble absorbing iron and B12. For the past little bit, my iron symptoms consist of lethargia, exhaustion, trouble getting upstairs, extreme thirst, dizziness, heart palpitations, extreme hunger, and so on. And both of those symptoms can mimic high and low blood sugar symptoms. So when I went to my doctor, I was like, hey, I have these symptoms. And the moment she heard I've been drinking more, she went, we're going to test your blood sugar. And I was like, okay. She's like, I don't think that's the problem. But I was like, okay. When those blood work came back, low iron, because my body can't internally process iron. But I also noticed that my blood sugar levels seemed on the lower side for someone who that day had eaten almost 2 meals prior to getting their blood tested. My blood sugar was at 4.4, which is on the lower side. It's not hypoglycemia, but it is on the lower side. And my brain went, that's kind of low for someone who ate 2 meals in less than 2 hours. Because, and again, having low iron makes you extremely hungry. My brain was like, oh, we don't have enough iron, so let's use the glucose necessary. So my brain couldn't figure out what was going on. So since it couldn't get my iron levels, it decided to tell me that my blood sugar was low, even though it wasn't, because one of the ways you can get energy is glucose. And so my brain and body were like, let's eat. Let's eat. I was literally getting hungry every 2 to 3 hours. So I thought, oh my God, do I have hypoglycemia? Do I have reactive hypoglycemia? Why am I hungry every 3 hours? Why do I not feel good? And I tested my blood sugar and turns out everything is normal, which is great. But it wasn't fun. It was my low iron mimicking other symptoms. Oh, I also forgot to mention something called interoception. People with FASD might have a really hard time with internal signals in their body. Why does that affect blood sugar? Because some people with FASD might have trouble figuring out when they're hungry and might wait way too long to eat. They might only start feeling hungry until they start getting low blood sugar symptoms. People with FASD basically might not also feel the concept of being full, which can unfortunately lead to excessive eating. Or so you as a parent or a caregiver might have to read your child's signals and might have to be their guide in when they should eat, or might have to remind them to eat, or remind them, hey, we ate an hour ago. Are you really hungry right now? Are you feeling those hungry signals right now? People with FASD can also struggle with their autonomic nervous system, which is also linked to your blood sugar and your body's ability to know when to raise its blood sugar or to lower its blood sugar with insulin. And that also could explain some irregular blood sugar. All right, now to show you how to test your blood sugar at home. Please, 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 please see if you can get it under insurance, because it's expensive. None of this is cheap. This is medical equipment. So I highly, if you think your child could benefit from you checking their blood sugar every once in a while, please get a prescription for this. I did not. I was lucky enough that the glucometer, the pharmacist actually gave it free to me, but the test strips, 2 of these test strips in a box, were $80. This is what is known as a lancing device. It's what pricks your finger. And this is the focus. I don't know if it's focusing. This is the lancet, and it goes in here like that. Hold on. Goes in here. Oop. Line it up, and it should click. And then you put the top on, clicks in, and I like to do it on 3. Could we not? It's not focusing. I like to do it on 3. We learned that 2 is not enough, but 3 is perfect. We got our test strips. These are what they look like inside. You should always keep these closed and in a dry environment, or they can go bad. This is the glucometer. Test strips will go in here, and then it will suck up your blood. So let's do it. We are actually I'm going to show you how to do this. You should always, not that anyone does this, should always take this out. There's this gray thing that pushes it out like that. And we're going to get a new one. I want a pink one. There's a guard on it. You pull it, twist it, I think. There we go. And then you put it in like that. Put this on like that. Always remember, because when I do this, I unlock it and lock it. Sometimes the dial moves, so sometimes it goes higher than you want. So I always make sure that the number is what I want. Then I am going to take an alcohol wipe, because you always want to wipe your finger. Which finger do I want to do? Either wash your hands or an alcohol wipe. If you're using an alcohol wipe, they sometimes say wipe away the first drop, because apparently alcohol can affect the reading. I don't know, I'm just drying it off. Woo, my testing kit, yay. This one has less in it. Open it up. Just gonna place that there. Okay. We did this finger, right? Yeah, we did. So this test strip lasts about a minute in the machine, so I got time. Lock it. You pull it and press this, and the needle will stick. So cock it first, then press it. Okay. Cock it back, press it. And you hear that ting, that's the needle. Okay, so what do I do first? I like to prick my finger first. That's what I like to do. So let's see. Always on the side of your finger, never on the pad of your finger. It's less painful. That's what I was taught at the pharmacy. See, I didn't cock it, so it didn't go. Okay, let's see. Oh yeah, we got. They also say not to milk it, but I don't know how you don't. So then we're gonna put the test strip in. Yep, this way. Try not to touch it on that side, because that's where the blood will go. And then we're gonna put the blood in. Let's see. Let's see. 5.7. That is very good. Yet again, we want it to be between 4 and 10, and I ate lunch. So that's a pretty low number, a pretty good number for having lunch like an hour or two ago. So that is fine. So we talked about today FASD and blood sugar. We talked a little bit about type 2 diabetes and how FASD correlates with metabolic disorders, which type 2 is. We talked about type 1 with FASD and the link of the autoimmune component. We talked about the relation between FASD and our liver storing glucose appropriately and how prenatal alcohol exposure can affect that. We talked a little bit of the autonomic nervous system and how that can affect blood sugar. We talked about hypoglycemia. We talked about reactive hypoglycemia and FASD and the link of that. We talked about how blood sugar can impact the way you're able to function and how that might impact someone's day-to-day life with FASD and how low blood sugar might make that more challenging and why there might be behavioral issues associated with low blood sugar. I hope you liked this video. Don't forget to like, comment, and subscribe, and I'll see you guys on the next video. Bye!